serious note, COVID cases have been increasing in almost every state, and some medical experts are warning about a possible summer surge.
But there is some good news that parents of young children have been waiting for. The FDA could grant emergency use authorization for a vaccine for children under 6 as soon as this summer.
UW Health Chief Quality Officer Dr. Jeff Pothof is back with us for his weekly visit. Hi, Dr. Pothof. Good to see you.
How are you guys?
Good. So cases are up. We had a surge last summer, and we had a surge the summer before, right? How quickly we forget.
Right,
2 years into the pandemic. But is there anything special to know about the cases we're seeing right now?
Well, I think the difference this year is we do have BA2 in the environment. We are seeing more cases. These cases we're seeing are probably an underreporting given how much home testing there is. So I do think we'll continue to see a bit of a surge in cases like we did the previous years. The difference this year is that we're more highly vaccinated, and we recently had that Omicron surge, which is affording some people some lingering immunity. So unlike the other 2 years where hospitalizations quickly followed those increase in cases, this year I'm hoping that the hospitalization trend comes up a little bit, levels, and then we kind of get out of this without the big demand of healthcare resources that we saw during these other surges.
Yeah.
And is that why Dr. Fauci made that statement, you know, kind of talking about the difference between the start of the pandemic to where we are now?
Yeah, I think what he's saying is, you know, we are in an endemic phase, and for the United States, it seems that way. You know, I think we're always hesitant to say things are completely better, but the idea that pandemic is when the disease is running rampant, we can't really stop it, hospitals are being overwhelmed, resources are being used up, that's not where we're at right now. We're seeing more cases, but for the most part, hospitals are doing okay. We aren't seeing as many admissions. So in that regard, you know, he's got a point.
That's good news. So this upward trend is not stopping large gatherings of people. We just saw that at the Met Gala and at the White House Correspondents' Dinner last weekend. They were really packed in there. And as the summer comes, people are going to be having their own gatherings. So how do you evaluate your risk?
Right. I think this is a great question because I think a lot of people, they just heard, you know, we can get rid of all this mitigation and they're like, okay, COVID's dead. And it's not, right? Like COVID's still around. What I look at is, you know, what's my risk? So and a lot of people are doing this. Are you vaccinated? Are you boosted? Have you recently had COVID? If that's the case, your risk for severe disease is lower, but Omicron is really good at causing symptoms, even if you've had Omicron before or you've been vaccinated, boosted, and that could be a fly in your jam for whatever you want to do this summer. So at these large events, no question, transmission is happening. Some people are getting symptoms, and then those people, which you're not seeing on TV, are sitting at home for the next week recovering from what is likely mild symptoms. So I think folks who have, you know, plans or things like that, certainly if you're high risk, even more a reason to say, you know what, maybe I'm going to avoid large gatherings, or if I'm going to go to them, I'm going to put my mask on to try to decrease at least a little bit the likelihood that I catch the disease, and I might not get real sick, but sure would be a bummer to be sick.
Yeah.
With all the, you know, the endemic stage being top of mind, it does seem like we'll take a few steps forward, a few steps back. Is there anything that we can predict with this data that we have that would help us, whether that be more boosters, more annual shots, that sort of thing?
Yeah, you know, I think the data we want to watch more closely, especially as we see additional subvariants, variants that are developing, and that's going to be a story that's with us for a number of years, is our current protection, whether it's previous infection or immunization, good enough to prevent severe disease? You know, worst case scenario, and we don't have this yet, would be a subvariant that's really good at defeating natural immunity, vaccine-induced immunity, and makes people really sick. That would be the thing that kind of turns us back. If we have variants that cause mild disease and we can kind of get through that, we don't overwhelm hospitals, that wouldn't be as bad of a scenario.
Quickly, we're really tight for time, but can we talk about the potential for a vaccine for kids under 6, maybe by this summer?
Yeah, I think you're going to see it by July 4th. Moderna is going to submit their data. It's possible by the time that's reviewed that Pfizer might submit theirs, but for those parents who are really worried about their young kids, I think there's some hope on the horizon with a vaccine early summer.
Oh, that's good to hear. We'll talk more about that in the coming weeks. Good to see you, Dr. Pothof. Thanks for your time.
Same.